Hello, today we are going to discuss about intussusception of kids. Intussusception is a condition where bowel telescoped on itself like this. Then, bowel wall to press one another and blocking the bowel. This can lead to reduced blood flow, that part of the bowel. And it is a bit like getting a sock turned inside itself. And so basically, uh, what are the symptoms you have to know, isn't it? Men will be the abdominal pain that will be severe. It comes and goes. Each episode lasts for 2 to 3 minutes. In between episode, the child will look pale, tired, floppy. After 12 hours or so, pain become more constant and child usually go off food and may vomit. Due to vomiting, they may become dehydrated. Symptoms of dehydration include lethargy, fewer wet nappies than usual, soft spot on top of the head being sunken, and the child may also have high temperature and swollen stomach, and their feces contain blood and mucus. So, how you can diagnose it? Basically, that doctors can feel it by pressing gently on the tummy or an ultrasound scan. The scan can just show that intussusception. What is the cause? Not sure. And the child may have cough, cold temperature, tummy ache in the days leading to intussusception, following vomiting, even past the bloods in the poo. We think the most of the time swelling in the blood bowel wall make it telescope itself. Now, how common it is? It is most common of bowel blockage in infant and young child. It tends to happen between age of 3 to 18 months. How it is treated? Now, as it causes the reduced blood flow, stop function properly, the effect of interception cause dehydration, for vomiting can cause most, become very serious and quickly in the child. So it needs an emergency treatment. If his child is dehydrated, needs that, saline, that fluid we give before even the treatment starts. And of course, child's nose we put on nasogastric tube and down the food pipe into the stomach. This will drain up the stomach and bowel content and vent any air that has built up, which will make the child more comfortable. The child will also give an antibiotic before treatment starts to reduce the chance of infection. An ear enema is usually the first treatment. In extra department, a tube is passed into child's bottom and air is released into the bowel. The work is by pushing the bowel back, and its susception correct itself. It is monitored using X-ray. If enema works well, they will be able to return home once they are well and feeding normally. If child is not well enough to have ear enema, and if enema did not reduce it, then operation under general anesthesia. So basically, it's the operation that is usually with the keyhole surgery. Occasionally, have to open wide open to see everything, and gently squeezing the bowel to push out the inner segment. And they will then examine the bowel to see if blood flow of that bowel is intact. If there is any diet bowel tissue, lack of blood flow, that need to be taken out by surgeon. Then after that, this operation, there will be the ward to recover completely, monitoring everything, their heart rate, breathing, oxygenation, pain relief by everything. Initially, child will not be able to eat anything as to allow the bowel to recover. There will be having drip, means saline, and nasogastric tube to drain the stomach content. After a couple of days, child will be able to feed again, and small amount of feeding, and then gradually to build up. So basically, after this recovery period, when